So I think the big question is going to come down to, do patients want a pill or do patients want a shot? Once daily oral Icotrekinra versus placebo, and once daily oral Deucravacitinib in patients with moderate to severe plaque psoriasis. This is ICONIC Advanced 1 and 2 phase 3 studies. So this was basically a head-to-head, active comparator study of two of them. ICONIC 1 and 2 over about 1,200 adults, moderate to severe plaque psoriasis. And so co-primary endpoints were PASI 90 and IGA 0 and 1 week 16. So Icotrekinra, 70% of patients achieved IGA 0-1 versus 10% on placebo. And if you look at, and then PASI 90, which was the other endpoint versus placebo, like 55 to 57% versus like 1 to 4% on placebo. So PASI 100 was 30% in the Icotrekinra group versus like 12% in the Deucravacitinib arm. So
Ooh,
I
that's
think
shocking.
that this would say then, we can say Icotrekinra once a day is going to be superior to both Otezla and Deucravacitinib.
The interesting thing is going to be, we've also got 2 second generation TYK2 inhibitors coming out, the Zasocitinib, and I forget the name of the other one. And to see how those, we're not going to have any head-to-head trials of those, but we should have head-to-head trials of those versus Deucravacitinib.
So just a little reminder, what is Icotrekinra? It is a peptide that is taken orally that binds to the IL-23 receptor. So it's a pathway blocker, but it works a little differently than the Skyrizi, Tremfya. So I think the big question is going to come down to, do patients want a pill or do patients want a shot? And I think that's like a big topic that companies are really interested in and looking at. And I think to some degree want to, have that narrative, like, do patients want pills or shots? I think that there's patients who want pills and there's patients who want the least frequent dosing that they can get.